would like to ask one more thing, that as a student, sometimes I don't go through a mental illness or anything, but I've seen people around me go through that. Sometimes as a friend, I want to care about it, I want to talk to the person about it, but the person is not ready. Sometimes I've seen situations where person has to go through suicidal attempts or something like that, and I don't think that will be the case only for me. There will be many other of my peers who will be not having or going through it, but must be seeing somebody else go through it. What would you suggest for students like me?
I think it's a very important question. Many peers, friends, students are always worried about others if they are genuine friends. And it is not uncommon. I mean, just imagine somebody committing or dying due to suicide. There are 5 others in the group who are genuinely affected, and they are at a higher risk. So, my response to your question is that there is a need to talk. You want more information, you want opportunity to discuss. Though primarily we don't run a helpline, but I must emphasize that the national helpline Telemanas 14416 is an excellent instrument for these things. It runs 24/7. It is managed by Government of India. It is managed by professors, associate professors, trained psychologists, trained social worker and volunteers. It is situated in 30 cities of our country. Every college or university must display in bold that if you need to talk to a mental health professionals, dial this number. Secondly, what we can do, we have an email facility, mansikshakti@gmail.com. You can write to us. Our people, our counselors will get back to you. We are creating a system where we are taking volunteers who have just finished their psychology training. We are training them for providing mental health education. So, there will be a dozen of them available on the website. You can book your time with them and they will talk to you, provide you information, not treatment. Let us not mistake. None of our people would provide treatment except the qualified psychiatrist and a registered counselor. They are eligible to provide intervention, to tell you what to do, what not to do. Rest all involved in the program will only provide mental health information, mental health education. You ask them what is depression, they would tell you. You ask them what is the complication of depression, they would tell you. You ask them what should I do, they will say go meet a doctor. That is not a question a educational counselor to address. So, we are trying to build it and it is a huge task, and I am sure in future we should be able to have a network of professionals who can respond. In fact, we want the universities to take this responsibility.
So, doctor, as you said, you would like universities and colleges to take the responsibility. Now, what should a college or a university do to approach you?
Well, I am approaching them and I am trying to get into the system which can reach me there. So far, I am happy to report that about dozen universities have memorandum of understanding with our organization. They are using the app for their students. We will have those results about 6 months, 8 months after, and we will definitely, with their permission, students are also asked, do you permit to publish this data, and they, if they like, they tick there in the consent and move forward. So, we are trying to reach the universities through 3-4 channels. One, if you know a vice chancellor or a university, you take me, that is through student volunteers. The second, we approach the university ourselves. The third, we try to reach the government, the honorable chancellor, that is the governor, who is responsible for all the universities in a state. We are requesting University Grant Commission to do something. We are requesting Association of Indian Universities to do something. I am in touch with the authorities. We are also talking to central government and Ministry of Education to do something. In fact, they are doing a lot. I must tell you, congratulations to Government of India. Recently, the Supreme Court has passed a judgment that government should establish a task force for student mental health, and it has been done very proudly to report that it has been done. We expect good results, and in fact, the National Medical Council realized the problem of medical students, and they constituted a committee and did a survey of 25,000 students and published a 125 pages report and given recommendation to be implemented in many medical colleges. How many hours a resident should work, what should be the food condition, what should be the housing condition. You know, suicide rate is very high amongst doctors. So the medical council is doing its own effort to cope up. Similarly, a lot of agencies are doing. I mean, I would not say that, and I'm happy that thousands of people are working in this field, but they all need to come together and frame policies, help people. It's a huge task. So about 30%, 35% population of our country is in the age range of 15 to 30, which is a huge population, is vulnerable population. Many of them are unemployed, they are doing daily wages job, they are earning less, they are educated, PhDs and MA and BSc, and not getting employment if you go into small cities. So they all have their own set of problems. And let me complete it. The psychological symptoms are the first symptom of any problem. I mean, if you cannot pay your EMI or you cannot pay your college fees, the problem is financial, but what happens to you? You get worried. What is worry? It is a psychological symptom. So whatever be the nature of problem, the first symptom is psychological, and that is why it is very important that the students must know their own psychology. We cannot expect students to know everything about depression, anxiety, eating disorder, alcoholism, unless we teach them. And I recommend and tell them that lessons of mental health must be written on first 2 pages of every textbook, and it is only then the change will take place.
I agree to you, sir, because we pick up a newspaper and every day there is a minimum of 3 to 5 cases, suicidal cases, which we read, and that is what is known. We don't know about what is going behind the scenes, and it is an issue which we must be talking about. There's one question which is lingering in my mind. Now I've given the test, and let's be real. What if I feel even more tensed after my result? What am I supposed to do now?
Well, it is vital question. It is common, not uncommon. It is common that somebody will see the report and if says you have high level of mental health risk, that he will be perplexed, that he will be annoyed, be angry, will not understand. But those students who know that I have problem, but they do the test, they are likely to have a sigh of relief that, well, I knew it's coming. But what every student needs to do, whether report is normal, abnormal, whatever it is, first thing you need to do is to go home, talk to your parents. They will ask you, why did you do this test? In the same fashion, if you go to a psychiatrist or your father, mother goes to a psychiatrist, that my son and daughter is 10th, the exams are approaching of the university and they are feeling disturbed. So we are going to ask them, tell me, what is your observation? Why do you feel so? Similarly, when you go with the report to your home, your parents are going to ask you, why did you do the test? You have to be honest to tell them that I did it for fun or I have the symptom. You have to tell them you have been suffering, you did not disclose. And that is where they are going to be convinced that yes, you need help. So it's quite likely emergence of symptom is known with all treatments. You take a medication, you may have a side effect. Similarly, you go for any test, there may be somebody pokes a needle and it may continue to bleed for a minute more. you go and do scan, you do repeated X-ray, there will be complications. All investigations have flip side of it, so this investigation also has a flip side, and we, in order to protect our students, we have this network, either to write to us. If you feel anxious, please dial Telemanas, explain them what's happening. So you have immediate contact. You don't have to wait for our organization to cope. We cannot cope with the demands of the students because we have just started. We don't have those kind of resources. But what we in principle believe that there is enough resource in the community, and our students must utilize that. You can at least tell your friend that this is what is happening to me. Let's go to not my parents, your parents, and talk to them. Talking is extremely vital. See, silence is fatal. One must remember.
Sir, I completely agree with you. Silence is fatal. We have to talk about situations which are occurring around us. Thank you so much, sir, for answering my questions today. I think the audience also must have gotten answers of questions lingering in their mind about the app as well. Thank you.
Thank you very much. Thank you very much for this.